Welcome back to Arise Xchange. 1 in 5 Americans now wear some sort of fitness device. The digital health craze is so hot right now that one company, Fitbit, saw its stock soar 50% on its debut this week on the New York Stock Exchange. Healthcare executives aren't surprised that Americans are turning to high-tech help. With us now is Dr. Daniel Tepper, CEO of Immune Pharmaceuticals, joining us here in the studio. Dr. Tepper, thank you. Good to see you again here on Arise Xchange. Health executives aren't surprised. Were you surprised by this explosion all of a sudden in sort of this personal health wearing devices?
No, we're not surprised. I think Fitbit is proving naysayers that consumer digital health is a business. It's here to stay, and it's going to be very profitable.
Are these devices really helpful to the consumers? Can they digest the health information that they're getting off of them?
Well, 15 years ago, I was involved with one of the pioneer digital health company, and we had early success. But the limitation was that we had no device that allowed, daily interaction with the consumer or the patient, and that's now available.
Yeah, and it's not just, I remember the first devices told you how many steps you walk a day and then how far you run. And then, of course, some of the Garmin devices will track where you're going. Now they'll tell you your heartbeat and your heart rate and remind you to take medication.
So that's one step forward. It's not only about diet and exercise, and now it's about, you have digital devices that tell you, your glucose level. And I think the next step is that your digital health information will be stored on your wrist. And that will enable you not only to monitor your health, but also when you go to your doctor or when you're admitted to the hospital, that they have the right information.
Well, that's very interesting. So your medical record could be on your wrist as well.
Absolutely.
Does that give you privacy concerns, though?
No, I think it's known how to monitor that very well now.
Do you think that consumers and health people, I won't say health nuts, but health people who want to stay healthy are going to get tired, though, of their watch telling them to get off the couch and walk around a little bit?
No, I think that 75%, actually, according to McKinsey's survey, 75% of people are saying, of all ages, by the way, it's not only teenagers, baby boomers, everybody wants to be more healthy. Mm-hmm. And, monitoring the health is something that if you can do it easily on your wrist, as opposed to having to go to your desktop computer, and then you went to your laptop, and then you went to your digital tablets, I think the more easy it is, the more people are going to want to be.
Does this also lower a barrier and take out a healthcare professional, sort of the middleman, if you will, and give the consumer more power, just as the internet and the web did originally by providing more health information? Now you're getting personalized health information.
Well, I think that physicians and healthcare professionals are looking, particularly in America, they're looking for an empowered consumer, an empowered patient, because otherwise, they can only give them recommendation that they don't follow. Mm-hmm. And very often treatment fail because the patient is not engaged. So an engaged patient means better healthcare.
Now, Immune Pharmaceuticals is very much involved in personal medicine. Describe that to me and how that connects to these wearable health devices.
Well, we select, patients based on biomarkers that, suggest that they may or may not respond to a particular treatment. So anything that allows to profile, patients is favorable. So we'll have a number of initiatives in the future that are related to to diagnostics, to monitoring, patients over time, mm-hmm. and also to making sure that they comply with their treatment. So yes, we'll have digital strategies as we continue to develop our devices.
Do you foresee an environment where the pharmaceutical companies are going to see this as a marketing opportunity, that they'll be able to basically advertise on some of these devices, that if your heart rate's a little fast, maybe you should go see your doctor and get some medication?
Yeah, I think that's, in the past, it was looked at a way to advertise, like a gimmick. Now it's part of a whole, treatment. So if you don't have those strategies of companion diagnostics and patient support and daily interaction. Remember in the beginning I was saying that 15 years ago, you couldn't have daily interactions with the patient or with the consumer. So I think it's part of the overall treatment strategy as opposed to a gimmick to advertise.
And it's going to also allow doctors to really get the truth from their patients, aren't they? You're not going to be able to go to the doctor and say, yeah, I hit the gym every single day.
Yes.
And when you don't.
Absolutely, absolutely. So I think it empowers the consumer, mm-hmm. but it also empowers the physician to achieve certain goals. And I think, most people, now want to achieve health goals. They don't want to be passive about their future and their health. And they want to remain young longer. Okay. So that's the way to do it.
Dr. Tepper, thank you so much for coming in. Good to see you again, as always.